this is Dr. Andrew Young. Again, we're over at St. John's. We're with Christy and Matthew, and we're going over physical therapy. And one of the most important things after joint replacement, whether it's knee or hip or partial, is just learning how to transfer out of bed. And Christy's going to take us through these mechanics. And we want you to see this because we also want you to practice this prior to surgery. Go ahead, Christy.
All right, so the biggest thing I like to tell my patients before surgery and then right after is you need to remember that the rest of your body still works. So you're gonna have to use your non-operated leg and your arms, your trunk muscles to help you move around. In the beginning, it's gonna be a little bit harder than normal because you have a lot of new pain and swelling that's from surgery that will go away, but in the beginning, you're gonna have to use the rest of your body to help compensate. So we're gonna say that he had a surgery on this side of his body, whether it's a hip or a knee, everything I'm gonna show you is gonna be the same, okay? So this is his good leg, his non-operated side, so we're gonna go ahead and have him bend this up. The first thing you wanna do as you're getting in and out of bed is to scoot to the edge. So you're gonna have to use your hands and your good side, okay, to try to scoot your bottom over to the edge, okay? So you're gonna push here and lift and move your hips over, okay? If you cannot do that, then we will help you, or if you can have someone at home help you, this is what's important to make sure you have somebody to help you at home, okay? So if you can't do that, then we're gonna help lift the other side so you can bring it closer to the edge, okay? So if we need to do caregiver training or spousal training, whoever's gonna be at home with you, these are the type of things we're gonna show them, okay? So now that you're closer to the edge of the bed, you're gonna be working on getting this operated side off of the bed. Now, I like to tell my patients to try and see if you can do it right after surgery because you may surprise yourself and find that you can't,
Sure.
okay? But if you try to move it and it's a little heavy, it's a little painful, okay, so then we're gonna help you with that. There's a couple of ways you can do it. What you're gonna wanna do possibly is use your arms to help, okay? Or use your other leg. You can kind of put this underneath to gently drop it off of the bed, okay? If your other leg isn't strong enough to do that, okay, then you'll have someone give you a little bit of help to assist it off the bed, okay? So you wanna go ahead and sit up, okay? And then if you can hook, this nice little hooking technique is an awesome way to help yourself get off the bed, okay? And then you can unhook as you're sitting up at the edge.
Okay, can you go over that part again,
Sure.
Christy? So just go through the mechanics. So they're lying on the bed. They're right in the middle of the bed. Step one, they're using their opposite leg and their arms to push to the side of the bed.
Correct, because you want to move your hips, the big part of your body, over.
Okay. Now it seems they have to get their foot to the edge of the bed.
Right.
And the tricks are do it on your own or to use your other foot.
Mm-hmm.
What is it? Yeah, let me see that. Hook technique. Okay, good.
Mm-hmm. You can hook your toes or your whole ankle underneath the other one, and it's a nice little trick. It really
Sure.
works well.
Yeah,
To
okay.
help scoot your leg closer to the edge of the bed and then to slowly lower it down. Usually that initial drop off is the most painful part, so if you have a little bit of help to get it off, if you can't tolerate it without that, that's a nice way to do it.
And then you're just completely swiveling your whole body at the same time.
Correct.
Great.
Yes. Okay. Now, getting back into bed, you're going to reverse the exact operation. So go ahead and stand up for me, Matthew. So the biggest thing you want to do when you're going back to bed is make sure that you're not going back to bed at the end of the bed, okay? So make sure you scoot up nice and high towards where your pillow is. Go ahead and sit down, okay? The first thing you want to do when you're getting back into bed, use your hands and your good leg to scoot your hips back. You want to try to scoot back and then even angle if you can, okay? So when you go back to bed, remember this one still works, okay? So you want to try to swing your legs up without helping, okay? So try to get your legs up by yourself. If you can't do it, you can do a hooking technique and hook it back and pull it back up onto the bed. If your other leg isn't strong enough to do that, then you would have a person assist you with this leg to get it back into the bed, okay? The biggest thing is making sure you position yourself well before getting in the bed, scooting your hips back as far as you can. Now once you're in the bed, if you find that you're still a little bit low, you need to scoot up. Again, you're going to be lifting up that non-operated side, pushing with your arms, and this foot to scoot your bottom up higher in the bed.
Yeah.
Okay?
I know this seems like a lot of work, and it is hard the first couple times you try it. That's why we want you to practice. But after you do it a couple times, people just get in and out of bed,
Yeah,
especially those who go to the bathroom 3 or 4 times a night.
Yeah, the more you practice, the better off you're going to be. So.
What are the common mistakes that people make as they're doing these bed transfers?
The most common mistake they make is trying to just sit straight up in the bed, usually before they just have their legs out in front of them. They're not positioned well. So getting yourself a little bit closer to the edge tends to work a little bit better. Now here in the hospital, you do have these cool trapezes and bed rails that you can use to help you whenever we're not there. But in therapy, we'll take those things away so you can actually use the rest of your body to help, which is nice. But again, if you can't do it on your own, we will do caregiver or spousal training so that they know how to help you at home.
And how does the caregiver help? What should the caregiver coach the patient on?
Well, the caregiver's job is to encourage the patient to try to do it on your own. Because even though it's painful and sore, the more you practice doing it on your own, the stronger you're going to become and more quickly. So, but if you're still trying and it's too hard, then you would have your caregiver or your spouse assisting you gently with your operated side to help move it in the bed or help you scoot up, stuff like that. But it's really positioning of the rest of your body because you don't want your caregiver or your spouse lifting your whole body in and out of the bed.
Right. So it's mostly just to coach you, tell you about your position and your form. It's not to lift you out of bed.
No,
Okay.
because really you should be able to do that, most of that on your own if you were able to do it before surgery.
Thank you. That's terrific.